Hello, my fellow Zambians. My name is Ethel Mangani Luva. I'm a nurse counselor. In our country today, there are a lot of people that are living positively with HIV. Thanks to their courage, because many more people have chosen to find out their HIV status. A number of those people who are HIV positive have started their antiretroviral treatment, or ART. Still, people who have tested HIV positive often struggle with another big decision in their lives, whether or not to have a baby. Others who have already decided not to have a child or don't want to have one now want to learn how to prevent an unplanned pregnancy. Since I am a nurse and a counselor, sometimes they come to ask me what they should do. I always advise them that these are decisions they have to make together as a couple on their own. But to make a good decision, they need correct information. Family planning is important to avoid unplanned pregnancy. Space the length of time between pregnancies to keep the mother and children as healthy as possible, and to help women living with HIV make sure they are healthy before they get pregnant, to reduce the risk of infecting her baby with HIV. It's also important because it helps HIV-positive women who are unwell or have just started ART avoid getting pregnant until they are back to health and are used to taking ART every day as guided by their healthcare provider. I recently talked to two couples who were deciding what to do about having children. They came to see me after attending a support group meeting of people living with HIV and AIDS, where the topic was being discussed. I would like to share their experiences with you.
Good afternoon, everyone.
Good afternoon.
I welcome you to today's support group meeting. But before we go on with the session, I would like to introduce new members that have joined the support group today. There's Paul and Miriam, and there's Evans and Ruth. If you stand up. Once again, you're welcome. You can take your seats. Today's topic for the session is family planning and HIV.
My name is Paul. I'm a bank clerk. When I was a small boy, my mother used to encourage me to play with numbers. Now, see where the numbers have got me. I have a wonderful life and a beautiful family. When you see my wife and I, you'll never guess that we are HIV positive.
My name is Miriam. I'm a teacher. That has always been my passion because I love children so much. We have two beautiful sons of our own. Thanks to the help we got from the clinic following the steps of prevention of mother-to-child transmission. Both our sons are HIV negative. 2 children are enough for us, but both Paul's family and mine want us to have more children. But we've got our own health to take care of.
We have been using condoms to prevent unplanned pregnancies. But of late, I've noticed my wife seems not interested in me. Makes me wonder why.
I'm worried because sometimes my husband forgets to use a condom and I'm scared of getting pregnant. So sometimes I just tell him that I've got a headache, I'm tired. I know he's not happy, but I still love him. I'm happy that he has agreed to come with me to the Positive Living Support Group because today they are discussing about the family planning.
I was afraid of getting pregnant. I have 4 children, and one of them is HIV positive. Not wanting a pregnancy caused a lot of problems with my husband. As for that, I gave my husband excuse after excuse. I'm grateful to the sister who understood my problem and also told me another method of family planning, but also condoms. After discussing the option with her, I decided to be receiving injection every after 3 months. I feel much safer now, knowing that I can never get pregnant.
Is that why you've been keeping away from me?
Yes, I didn't know how to talk to you about it.
I think we need to see that nurse. Maybe that nurse can help us.
Thank you very much, Linda. I hope we're going to learn something from Linda's story.
My name is Evans. I've worked as a mechanic since I was a small boy. I started as a spanner boy. I've done a lot of repairs. I love cars. I love football. In fact, I'm a Man U supporter for life.
My name is Ruth. I met Evans at church, and a year later we got married. When a mobile VCT came to our community last World AIDS Day, we decided to do an HIV test. We tested both HIV positive. We thought our lives were over because we were just married for 1 year.
Ruth has been very sick, and we went to the clinic. They advised her to be on ART medicines because her CD4 count was very low. She has been on ARVs for 1 month. Now she has started to improve.
I'm feeling better now that I'm on ARVs. Though we've not told our family yet about our HIV status. They've been asking when we are going to have a child. I really want to have a baby, but I'm scared.
Since Ruth is getting better, our desire to have a baby is getting stronger. And I too want to have a baby. But I'm worried about her health. If she became pregnant, then she might get sick again. At my workplace, somebody told me about a support group for people living with HIV. And I asked Ruth to go along with me so that we can discuss this problem at the support group.
I've just found out that my baby is HIV positive. I got pregnant a few months before starting my ARVs medicine. At that time, I was very sick. The doctor told me I would have waited for a few more months when my health was much better by starting ART. I would have avoided my baby getting the HIV from me. But I didn't know how to avoid the pregnancy apart from using condoms. And my husband didn't want to use condoms. I wish we had more information.
Thank you very much for coming for this meeting. We'll meet again next week. You are free to go home now. Thank you.
The woman's story sounded like our situation. We must speak to the nurse about it.
Oh, yes, dear.
Evans,
Hello.
I'm Patrick. This is my wife, Rita.
Hi, Rita.
Hello, Evans.
Hi.
Hello.
We are just listening into your discussion. We seem to have a similar situation in our home.
Actually, we've been married for 5 years now, and we're both on ART. Lots of pressure has been coming in from our family and friends about us having children. We would have loved to have children also. How would life be complete without children?
Imagine just leaving the two of you forever. How possible is that?
Especially now that we're feeling fine taking ARVs.
You know, we discussed that a lot, but we decided we're not going to have any children.
Why did you decide not to have children when both of you are in perfect health?
Well, at first, we were worried of having a child who's HIV positive. Even with the PMTCT in place, there's a small chance that we can end up having a baby who's HIV positive. We're also worried about the complications for Rita during pregnancy and delivery. Besides, we're also worried about our own health. And you know that being pregnant will put a heavy burden on our health.
Moreover, what will happen to our child if we're not around to take care of it? This time we're living with the help of God and the help of the ARVs. Supposing we both died today, how sure are we that the community and our family will look after our child the way we are supposed to?
We are at peace with the decision we made not to have children. We are practicing family planning to avoid any pregnancy. Besides, we spend a lot of time with the other children in the family.
So after the discussion in the support group, the couple came to see me to discuss their family planning options, and this is what we discussed.
As you know, sister, we are both HIV positive, and we already have 2 children who are HIV negative. We've thought a lot about what we heard at the support group meeting. Although we wanted to have more children when we got married, I don't think we would want to have any more children.
Sister, since we are both HIV positive and both on ARVs, is there any other method, any other option we can use besides condoms? Because condoms, I sometimes forget.
And sister, I've heard that ARVs don't work well with family planning, so I haven't tried any so far.
I'm glad to see that you've been discussing these issues together as a couple and you have come to see me. I respect the decision that you are going to make. ARVs and contraceptives actually have no problem. They work well together. There is nothing wrong with somebody taking ARVs and contraceptives at the same time. The only thing is you have to remember to use a condom every time that you have sex, because the condom is the only method that can protect you from pregnancy and infections. Using a condom and a method of family planning at the same time is called double protection. There are 2 types of condoms. That's the female condom and the male condom are the only methods that can prevent you from pregnancy and infections at the same time. So long you use them consistently and correctly, you are sure not to get pregnant or to get any infection. We have other methods of family planning also. We have the injectables. This is the Depo-Provera. The Depo-Provera will prevent you from getting pregnant, but you have to come for an injection every 3 months. This Depo-Provera will only prevent you from getting pregnant, but it will not protect you from infections. So when you are using the Depo-Provera, you have to use a condom at the same time. But Miriam has to remember to come to the clinic for an injection every 3 months, and women that are HIV positive can actually use the Depo-Provera safely. When you've used the injectables for some time and you still don't feel like having children, you can actually use a more permanent method of family planning. Like Paul can have what we call a vasectomy. A vasectomy is a very simple operation which a man can have so that he doesn't have any more children. And men that are HIV positive can actually have a vasectomy done on them. Miriam can have a sterilization. This can prevent Miriam from getting pregnant for the rest of her life. And women that are HIV positive can also have a sterilization done on them without any problem.
I've heard that abstinence is the best option if you really don't want to have children.
It's true, abstinence is the only method which is 100% safe, which will protect you from getting pregnant. But it's a decision that has to be made by the two of you, because you have to stick by the rules for it to work well for you. And for people that are in marriage like you, I really don't think abstinence would be the best method. But if you decide that's what you want, there is no problem. You can still go for it. And it's good that Paul can come with you to the family planning clinic, because it's very important that men actually take part in decision-making concerning family planning methods.
Thank you very much for the information, sister.
Let's now join Ruth and Evans.
We really want to have a baby, sister. Our families have been putting pressure on us to have a child. Becoming a mother is something that I feel it's very important and I really want it. But listening to the story of the woman in the support group, we are really scared. We might have a child who is HIV positive, which is really unfair for the child.
Actually, we are so confused, sister. We know we're HIV positive, and this is a thing that we must think about as we make our plans for the future, especially if our family is involved. But Luther has just been getting sick and is now becoming okay. Making her pregnant again may make her fall sick, and I'm worried about that.
I'm very glad that both of you have come here together to come and discuss the issue of your having a child. There are ways that can reduce the chances of transmitting the virus from the mother to the baby. This is what is called prevention of mother-to-child transmission, or PMTCT. When a woman has been on antiretroviral treatment for some time, say 3 to 6 months, she can get pregnant so long she doesn't have any opportunistic infections like tuberculosis, she doesn't have any side effects from the drugs, and she doesn't have any problems at all. She can actually get pregnant, but she has to follow the instructions that are given to her by the counselors, the PMTCT counselors, about what she's supposed to do during her pregnancy, during delivery, and the feeding option that she's going to take after she gives birth. And after the baby is born, this baby can actually have a test done on after about 18 months to check whether the baby is also HIV positive or not. In some places, they do it even earlier, where they have the tests available. If the baby is found to be HIV positive, the baby is going to be put on ARVs. What is very important here is that you have the support of each other. You support each other in the decision that you're going to take, and you have the support of both families in the decision you take.
Thank you, sister, very much for sharing all this important information with us. We're going to think about it and see our way forward. But until then, we'll continue to use condoms.
Are you using any method with the condoms? Well, let me tell you about the other family planning methods that we have available. We have the birth control pills here. These are pills that Ruth will have to take every day. As long as Ruth is taking a pill every day, she will not get pregnant. But the birth control pills are not going to protect you from infections. So when you are using the birth control pill, you should always use a condom at the same time. And these birth control pills can actually be taken safely with the ARVs. They have no problem even when you are taking the ARVs. The other thing which is important while you are taking the birth control pills is to remember to take a tablet every day. Should you forget to take a tablet, you should take one as soon as you remember. But if you continue skipping tablets and forgetting to take tablets, that is going to put you at risk of getting pregnant. So it's very important that when you are taking the birth control pill, you use a condom alongside the pill. This is what we call double protection. We also have another method here, which is called the Jadel. These are two plastic rods that are inserted under the skin in the left upper arm. These Jadels, when they are inserted, they work for 5 years, and they are going to protect you from pregnancy for 5 years. If you decide to have a baby before the 5 years, the implants can be removed. And when they are removed, your fertility will return immediately and you can have a baby as soon as you want to have a baby. But again, this Jadel is going to protect you from getting pregnant, but it's not going to protect you from infections. So when you are using the Jadel, you have to remember to use a condom again. And the Jadel can also be safely used even by people that are HIV positive and are on ARVs. There is no problem with that. And the Jadel works for 5 years. Another long-term family planning method is the intrauterine contraceptive device, commonly known as the IUCD or the loop. This is a contraceptive device that is inserted into the uterus or the woman's womb. The loop prevents pregnancy by causing temporarily reversible changes in the uterus and uterine tubes that inhibit fertilization. The copper-bearing loop is effective for 10 years, but it can be removed at any time one wishes to. This method can be used safely by women living with HIV/AIDS who wish to use an effective contraceptive. However, a condom should always be used with a loop.
Thank you, sister, very much for sharing this important information with us.
Thank you, sister.
Remember, whatever you decide, it should be a decision you agree on and make together. It's been some time since we last saw our two couples. Let us now go and visit Paul and Miriam and see how they are getting on and what decision they have made.
We are still strong in our decision not to have any more children. We continue practicing safe family planning methods such as Depo-Provera injectable and a condom.
We are also continuing on our ART program. As you can see, Paul and I are doing fine. We are also looking forward to a more permanent family planning method such as a vasectomy or sterilization in the next 6 months.
Now let us go and see Ruth and Evans.
We've decided to delay getting pregnant until after I take ARVs for 6 months without any problems of side effects, opportunistic infections. And at the moment we are using family planning pills as well as condoms.
I can see that Ruth is getting stronger and healthier every day. She has had no side effects, taking ARVs together with family planning pills. Both of us are happy with our decision to wait and hope to have a baby soon.
Let us now go and see the third couple from the People Living with HIV and AIDS support group and see how they are getting on.
We are still at peace with our decision not to have children. And Patrick had a vasectomy performed on him last month.
We are now focusing on positive living and being a support to each other.
As you can see from this film, there are many options for people who are HIV positive to practice family planning. There are good things and challenging things in having a baby if one or both parents is HIV positive. There is no right or wrong answer. The important thing is that these issues should be discussed as a couple with family members and a counselor. It is our job as providers to give you all the information you need without making any decision for you. Each family is different, and the decision is yours to make. Talk to your healthcare provider today and learn the family planning options available to you.